Hello, everyone, and welcome to the Hormone Genius podcast. Teresa and I are here today, and our focus is going to be really centered around the woman in her mid 40s and above. We get so many questions about how to manage our cycle, our hormone imbalance symptoms, difficulty losing weight, stress, mood problems, all those things. And so we thought we would focus primarily on this age group. And we did even ask our listeners for some questions. So we'll be working hard to answer those. But this is going to take the form of kind of a Q&A between Teresa and I. She recently just led a talk for the PAX conference. And so I just heard so much about how well she did. And so I really want her to feature on some of those things that she did talk about at the FACS conference for all of our listeners who are unable to make the FACS conference. If you don't know what FACS is, it is factsaboutfertility.org. Be sure to check it out. They make their mission to educate medical professionals about cycle charting and hormone awareness. So, with that, Teresa, let's get started. Um, let's just begin by talking about the importance of understanding the difference in hormone support and womanhood support to women in the mid 40s and above, as compared to women who maybe are just entering into their 40s and maybe into their mid 30s. So, how does support differ, and why is it important to understand that?
Okay, so that's a good question, Jamie. And I think, what I'm excited about is that this topic about hormones in, we're going to call it the perimenopause to menopausal years is certainly getting a lot of attention right now. There's been a lot of people on podcasts and even in Hollywood. There was an actress that went even to Washington D.C. to discuss menopause care. Um, I'm blanking on what her name was, but most of you will probably know her. So there's been a lot of talk about the use, actually just care around women in this age group. What's different sometimes about the care of women and hormones in perimenopause to menopause is that the deficiencies that occur for women in this age period are actually the standard. Let's compare that to a deficiency that happens to a 35-year-old or even a 25-year-old, maybe with PCOS or with PMS. Those are more pathologies or, conditions in women's health that aren't as common. But what happens in especially the very late perimenopause to menopause years, will be the most common thing that happens to every woman in that age. And so, because it happens to all women, number one, you're going to have women that all need this care to some degree, right? Whether they do hormone therapy or not, they need some sort of probably understanding and education around it. But the likelihood is that, and this is what I tell my patients, every woman going from that transition to having ovarian hormone production to not having ovarian hormone production is going to have to make an incredibly important decision about whether they choose to let that process happen naturally and stay at a very, very kind of zero level of hormones, or do they choose to bring that up off the floor? I always say bring the hormones off the basement floor and have a foundation of hormone protection or therapy for the rest of their life, or for at least a period of time post menopause. And I make that a very serious question to my patients, almost like I'm like, hey, you're 47, 48 right now. Let's start this conversation now, because I want my patients to be educated enough to be like, when they get there, they're like, Teresa's been talking to me about this. I'm informed, and this is the decision I feel like I'm going to make here.
Such an important topic, and one that I'm also noticing is picking up steam and its attention. And, I'm glad we're going there. And you mentioned hormone replacement therapy. So, for people, first off, who don't necessarily know what perimenopause is exactly, they may be hearing it more so, but they don't exactly understand when that begins. or how to know that that's beginning in terms of our symptoms. Maybe we could talk about that. And then let's talk about what hormone replacement therapy is. So, what are some common symptoms that you see in your patients? And when do you begin seeing some of these changes with perimenopause? And then how do these maybe intensify as they get closer to actual menopause?
So I like to describe perimenopause as and this is not, I didn't come up with this, somebody else did. So you'll hear this commonly as reverse puberty. And
Yeah.
it makes sense. When we talk about a young woman going into their cycles, we'll say it takes 4 to 6 years for the ovaries and the reproductive system to mature. And in that period of time, there are cycles that are irregular or your bleeding can be kind of off.
Mhm.
Maybe you have more symptoms. And then when we get to the back end of that at around 45, and again, this is going to be different for everyone because not everyone goes into menopause at the same age, although the average age of menopause is around 51. But that 4 to 6 years before a woman goes into menopause, we call that perimenopause. And in that period of time, a woman can notice changes. And I think the first and most obvious change that they may notice is what happens with their menstrual cycles.
Mhm.
So the menstrual cycles can become shorter. They may actually become like more around 24 to 25 days versus your typical 28 to 30 days. You may notice that you're having either heavier periods or even lighter periods, or the flow just might be different.
Mhm.
You may notice more spotting at either the beginning or the end, and that can be a little bit to sometimes even more dryness vaginally or dry skin. Your drive, your energy, your motivation, your libido or sex drive may be lower. A lot of women will notice that they feel more premenstrual, like they'll have PMS symptoms that are worsening. And I think, one of the questions Jamie and I kind of joked about is some woman asked in the questions about perimenopause, does every woman hate their husband in perimenopause?
Yeah.
Well, I mean, if for you, every woman's going to experience these symptoms differently. And to the degree each one may be severe, may be different, but like mood instability, irritability, rage, these are things that I hear on a weekly basis from women in perimenopause.
Mhm.
Some women will feel kind of like their joints start to hurt.
Mm.
They may kind of have an old injury from playing sports back in the day. And all of a sudden, that knee is going to start hurting again.
Right.
Or, I start noticing pain in my wrists or my elbows. Insomnia or disrupted sleep is a huge one. So you notice that you're waking up at 2 to 3 a.m. and it's like your brain lights up and you just can't stop now thinking about what all the things you got to do tomorrow. And that's a common kind of tale of just disrupted sleep. And then heart palpitations. That's another one. I don't think every woman gets that one, but please know that that's not uncommon to feel like almost like your heart's kind of fluttering or
Mhm.
you skip a beat and if you can feel it in your chest.
Mhm.
Um, yeah, those are kind of the basic ones. Oh, and weight gain. And I'd also say gut issues. I think
Mhm.
all of a sudden women will complain of like, gosh, all I'm sensitive to all these foods that I wasn't anymore, that I used to not to be. And so food sensitivities and gut issues, I think, start to increase as well. And then just brain fog. My brain isn't like connecting the dots. I'm not able to find words as easily. I feel like I'm just kind of like, am I getting Alzheimer's?
Mhm.
Women in their
Right.
late 40s are kind of asking that question and it scares them,
Right.
right? It scares them.
What I think so interesting is just thinking about all these seemingly unrelated symptoms that you wouldn't necessarily maybe think, oh, it's my hormones, like brain fog, dry skin, and stress or difficulty sleeping. And we do know those things are affected by hormones, but just by how much, like heart palpitations, how much our hormones affect all of these things, right? And so how much we even as women who are not quite in the close to menopause years, take for granted, the benefit that our hormones are giving to our body and to our brain and to our heart and to our bones and all these things. And so I think just knowing all the ways the perimenopause affects our body is a testament to how many ways our hormones help our body. So let's talk about what are ways that we can support our body in this transition, because of course, after that long list of things, people are probably like, oh my gosh, like my life is ending. How am I ever going to feel like myself again? Is there hope for me? So, what do you tell women, Teresa, who are feeling these symptoms? What are some things? And again, we can touch on what hormone replacement therapy is. Let's kind of start there, and then we'll kind of work our way, back into some other things that we can also give a whirl.
Yeah, because I definitely think, Jamie, sometimes it's the obvious and we talk about kind of the, not the obvious, but the basics, right? I mean, it is just so important at the point where you reach your late 40s that you do not skip out on the basics, the foundation of health. And that's what's, I think, kind of apparent is you're going to have to work so much harder to become a healthy person in your 50s and 60s. And I always tell women, you're going to have to start training to be the badass 65-year-old woman. You
Mhm.
see that woman in the gym at 65 and you're like, holy crap, check that woman out. She's got pipes. She can squat like nobody.
Mhm.
She's on the treadmill or whatever. You're going to start training for that. And
Mhm.
and there and it's not about like the body. It's
Right.
not about how she looks. It's about her health. It's
Mhm.
about the fact that at 65, look what she's doing. At 75, she's going to be still out in the garden, doing all her yard work. She's going to be driving around, traveling. She's
Right.
going to be picking up her grandkids off the floor. And I don't know about you, but I think every person, when they start to age, are like, that's the person I want to be. I want
Totally.
to still be able to do the things that I want to do. So when you get to even, 45, I want to reframe the way you think about health. You're training now to become a badass old person.
Yeah.
And it just takes a much more concerted effort to do that. And so the foundation of that is sleep and nutrition, and those are equal in some ways. I mean, you might say nutrition more than anything is probably going to affect people's health, but sleep is probably equally as important
Mhm.
because if you don't sleep, you're never detoxifying all these toxins that go through your brain. So that brain fog's never going to get better, and you just won't feel yourself, right? You just
Right.
won't feel good. So sleep and nutrition, and the more, we can't go into the details of nutrition heavily because we've done that before, Jamie, and it would take such a long time. But if you just focus on plant-based foods, high protein, getting enough protein, which I say high, but getting enough is just high protein,
Right.
and just getting out the crap, if we have to keep it simple. But those two are so important. And then the third would be the stress. And I do think this was one of the questions is, I
Mhm.
mean, almost does stress cause perimenopause, or what's the relationship between stress and perimenopause to menopause? Well, it's huge. And I'll
Right.
tell you why. Because, and I was telling this to a patient yesterday who, again, was getting frustrated. She basically said her menopause was hell. And it was hell, not just because of menopause in general, but she had gone through, a lot of health issues that were making it much, much more stressful. Her parents had died. She was having a significant health issue herself. She had had multiple surgeries. And she basically said, menopause has just been hell for me. But what I told her was, the stress that she is under, of course, is compounding her menopause significantly. Here's the deal. When we go through this change, I want everybody to imagine, what was the purpose of evolutionary wise, why did this happen? Well, I don't know exactly why we were chosen as out of the two genders to like lose hormones, but it does have implications for what happens to the female body when she loses this ovarian hormone protection. First and foremost, since procreation is one of the main survival mechanisms of the human species, when a woman doesn't procreate anymore, in some ways, she goes down on the priority chain for her value.
Mhm.
And and that I say that only just so you can understand why these changes occur in the body that are so freaking frustrating to women, particularly the weight gain thing.
Yeah.
Because what the body says, is like, oh goodness, we're not making estrogen anymore. Where did estrogen go? And it knows how important estrogen is.
Mhm.
So it's going to make estrogen. How does it make estrogen? It puts it in fat cells,
Right.
and it puts it around the belly because the belly is where all your visceral organs are. And so the body is saying, how do I make this person survive when in reality her level of kind of importance has gone down.
Mhm.
So it's putting estrogen as a protective mechanism there. So, and I know that doesn't look good or feel good, but that's the reality of why it was supposed to happen, to be a protective way to help our species survive after 50. And past 1900, before 1900, we didn't live past 50 much longer. So this is a whole different shebang now, where we're living into the 70s and 80s and beyond. So that fat is part of evolution. And the cortisol, what happens is that your adrenal hormones, when you lose estrogen, say, oh gosh, again, where's estrogen? Crap, we're going to make the adrenals push out more hormone like adrenaline and cortisol because we're worried about this person. And again, what does that do? It drives this kind of train where you have higher levels of cortisol. It causes a lot of symptoms like the sleep loss and things like that. But it also makes the body store more fat and it makes our metabolism go down. So these things are just happening without us even trying, without us even
Right.
knowing, right? And that's why you hear this common story of, I woke up one day and I can look at food and I'm still putting on weight. I don't even eat
Yeah.
it. I just look at it.
Right.
And I'll tell women, I don't care if you started out overweight. I don't care if you started out as the skinniest person in my patient room. It happens to every woman. No
Yeah.
one, no one really gets out of it to some degree. And it is the most frustrating part, I think, for women, because it's the thing that we care about as women.
Yeah.
We want our bodies to feel good.
Right. It's interesting. So, like throughout the span of the ages, and I think we talked about this actually in one of our recent episodes, is beauty changes based on the era in which you live, right? And so right now in our culture, like being thin and fit is of high value and it is healthy, of course, like depending on the mental frame of mind of that person and depending on, their stress level and all this stuff. But what's interesting too is that like you're saying, if if retaining some of that weight is protective, maybe it does take a reframe of how we view body image, especially going into those wisdom bearing years. Because again, 100 or 200, 300 years ago, or whatever, that was seen as very beautiful, like these very like filled out women, even in their childbearing years. Because of course, you also need to have fat and be, a healthy woman to sustain life. You don't want to be skin and bones. So just interesting to know that, as we progress through the years and our decades and whatnot, that changes. Okay, but what I hear you say, so I wanted to say that thing, but I also wanted to say what Teresa's explaining to you all, ladies, is that it's a cocktail. There are all these things. A lot of times people ask, what's that one thing that I can do? Like I need a magic bullet to fix all my problems because I hate the brain fog. I hate the difficulty losing weight. I hate the rage. I hate all of it. And it's not just a one thing. It's a cocktail of things. And so what I think is interesting, this is on letstalkmenopause.com. That's a really great website and resource for women approaching menopause. 38% of women in late perimenopause, so this is very common, again, report symptoms of depression, irritability, mood swings, all these things. So we know that 2 to 4%, or 2 to 4 times of women who've never experienced depression, so women haven't experienced depression earlier on, are 2 to 4 times more likely to experience a depressive episode during the menopausal transition. And so what I think is interesting is, again, like you were saying, there's premenopause, which is before the like before menopause, the time frame leading up to menopause, but perimenopause is around the menopause time. But for women just to know and be aware, I think is the first thing. I think some women don't even know what perimenopause is, which is no fault of their own, but even just being aware of these changes help us understand that this isn't something that we blame ourselves for because we're so good at shaming ourselves. Being so aware of that is important. So I guess the reason I'm saying all of this is for those of you listening, just know it's a cocktail. Some women are going to notice this more intense than others, but there are things we can do besides just being aware. And so let's talk about some of those things. And you mentioned them already. So exercise and movement, increasing our muscle mass, because when our muscle mass increases, our metabolism increases, our bones strengthen. I was reading about how Teresa, like earlier on in your childbearing years, you could go for a run, and you could do your sprints and you could do your long distance training and all of that. And women continue doing that, but when they hit late perimenopause, menopause, they start gaining weight. And it's because it's so stressful to the body. It can be so stressful. So if you're finding yourself being active and exercising, but you're gaining weight all of a sudden, it may be just your body's way of telling you, slow down. Go on a walk instead of a run. Start lifting weights. And I think that that workout plan can really start transitioning from hardcore workout, if that's you, to being more slow about movement. Because again, we think that the harder we work out, the more we lose the weight, the better we feel. But often, I think in that late perimenopause time, it can have the adverse effect. Do you find that that's true, Teresa?
I do think in general it's true. I always say like there's always going to be something to prove the opposite. Someone else they can do fine with running still, but that is generally true, Jamie. So my kind of mantra about it is lift weights. Healthy women lift heavy, and that was our latest episode. To also walk, and so with walking, what I say is get a tracker, a Fitbit, and an Oura Ring, whatever it is that tracks your steps. Find your baseline. So, because that's the key, is like some baselines might be 10,000 a day already. Well, if you're already 10,000 a day, you're probably going to have to push your step count up to 15,000 a day. So, whatever your baseline is, go up another 5 to 6,000 steps. I just know I had a girl in my and a patient in my office, and we were talking about her sedentary lifestyle only because she has an office job and she just doesn't move that much. But this is classic, like, oh, but I work out 30 to 45 minutes a day, but the rest of the day I sit, so that may not be enough to just, do that 30 to 45-minute workout. I think we have to get this kind of constant idea that we need to be moving more. And so look at your step count, push that up. And the last one I tell people is some sort of Pilates, some sort of like really core based exercise where you're really kind of toning those legs and abdomen. And I think Pilates are great for that. And I don't even like, for me, I probably do 3 exercises consistently. So I don't do like a whole Pilates routine. I just focus on 3 exercises that I do 4 to 5 times a week. And so maybe someone could pick 3 exercises, but I think they'll feel better about their core if they can do that consistently. And then I just tell people push-ups and squats. Push-ups are hard.
Yeah.
That's why people don't do them that much, especially women. And I think if you're doing them consistently, you're just going to get stronger.
Yeah. Yeah. So I think what ladies, those of you who ask the question of how do I manage stubborn weight gain, we're hopefully giving you some ideas of things to start with, right? So Teresa, you said push-ups. What were the other push-ups, sit-ups? What was the other one?
Push-up Pilates.
Oh, Pilates. Yes. Okay. So that's one, going on a walk, making sure that you're lifting heavy things. I love that so much. And then also managing our stress level. One thing that I find to be very important that again in the documentary The Blue Zones on Netflix, and we talked about this before, Teresa, but like really assessing the centenarians, the people who are living 100 plus years, um, just also the importance of community. Because I think again, as we get older, we can feel very isolated. We're taking care of family members who struggle, our difficult teens, our aging parents, maybe feeling like there's turmoil in our marriage, and we can feel very isolated. And for women in particular, we heal in community. We don't really heal in isolation. So I think it's important to know that community actually does help us live longer. So, according to some of these blue zone areas, but I just think this is interesting. So, and maybe I had shared this before in an episode, but there was a team of researchers, Teresa. They wanted to study the effectiveness of how community can heal people. So, they brought 42 married couples into a hospital and created several small wounds on their arm. Then they placed devices over the wounds to measure the rate of healing. So the results revealed that it took almost twice as long for the wounds to heal for couples who reported having hostility in their relationship. What that means is that if we don't have a strong sense of community, that we actually it does take longer for us to heal. And I think that this research study, it does share, yes, the importance of having a healthy marriage, but I think what it does more so is creates this understanding of how important it is to have healthy relationships. So if you are struggling in marriage, let's say, get counseling. Meet with some gal friends that can provide some of that really needed community. And then also in a 20-year Harvard study, it was found that your physical health is more determined by relationships than the food you eat, the exercise program you are on, and the genes you inherited. So sometimes I think we overlook the importance of being in community, and even better, be in community with women who have the same goals as you, spiritual goals, emotional, mental, physical goals. Go on a walk with your friend, lift weights with your friend. That could be a really, two birds, one stone situation for those of you in the late perimenopause years, in any age, honestly.
That's really great, Jamie. Those are great examples. And I do think that goes all to the stress reduction. We've got to get
Yeah.
that cortisol down, you know?
Right.
So all of us helps that stress reduction. Jamie, let's switch gears into the hormone replacement therapy because I
Absolutely.
think so many women want to know, what do I do about hormone replacement therapy? And of course, at the beginning of the episode, I said I want patients to make this decision very informed. And so honestly, when I ask patients about whether they think that maybe I'm sitting with a 48-year-old who isn't in menopause yet, but she's perimenopausal and we're dealing with some of her hormone imbalances, but we're not at the point we're doing hormone replacement therapy fully yet. And that's because her ovaries are still making some hormones. But I'll say, let's have you educate yourself on the benefits of hormone replacement therapy past menopause so that you can understand whether or not you would actually want to do that. Here's the deal: the overwhelming amount of women everywhere are candidates for hormone replacement therapy and can safely take hormone replacement therapy. So that means, again, you want to be able to make this decision for you in cooperation with your doctor with a really important conversation. Not all doctors feel confident around menopause. And so if you have a doctor that just seems to poo-poo the question, doesn't seem to really understand what you're asking about, tells you that hormones should never be taken, tells you that hormones cause cancer, that's not the doctor to be having this conversation with.
Right.
So you want to have it with someone who's informed about science and the studies that are, understood today to reveal that hormone replacement therapy has significant benefits to decreasing, disease, but also improving longevity and health and quality of life for a woman long term. And you want a doctor to be able to fluently be able to talk through that conversation with you. What hormone replacement therapy is, it's just the replacement of a deficient hormone. And so when we go through menopause, which is 12 months with no period, a woman's ovaries will now not make two very important hormones, estrogen and progesterone. And then we're making a decision to replace those first and foremost, estrogen and progesterone. Now, there's other hormones we can talk about, like testosterone and DHEA too. But I always talk to my patients of, let's get that one straight first, because that's the most important. And estrogen is one of the most important hormones to the body. Progesterone is too. But we know estrogen in particular protects the brain, it protects the heart, and it protects our bones. And those are kind of the three areas that if we choose to do some sort of hormone replacement therapy, we're going to be getting these like benefits, longevity, health benefits in those three areas that are really important to consider, particularly heart disease.
Yeah.
So heart disease takes women off this planet 7 times more than any other disease out there.
Mm.
That's the most common way that people end up leaving and dying on this earth. So that's the one we really want to consider, because if estrogen does have a protection, which we know it does. In fact, Jamie, I don't know if you saw this, but in just the last month in April, it was either the end of March or April of 2024, they had come out with a study that it was an observational study where they looked at 10 million Medicare patients. 10 million Medicare patients. This is a huge,
Yeah.
huge
Huge.
study. So they went back and they analyzed all of these patients' charts. It was called a Cox regression analysis. And what they found was is that those patients who had stayed on estrogen or progesterone therapy past 65 years of age had improvements in heart disease, lung cancer, colon cancer, breast cancer, and an all cause mortality reduction of death by those things of like 19% less.
Wow.
And so that was huge. And that just came out,
Wow.
and so these are things I really want my patients to be able to understand, that it's not just about hot flashes. Yes, I mean, you're going to feel all these symptoms that we're talking about. They do get better with hormone replacement therapy. But it's not just about that. There's a decision that you're making about kind of like if you want this protection to your body that estrogen gives.
Right. I remember Teresa referring a friend of mine to you. This was like a couple years ago. And she, like 3 months later, was like, it changed my whole life. It changed her whole life. Like just getting these hormones when she wasn't experiencing it before. And there's this unfortunate misunderstanding of hormones, which is interesting, right? Because when we are cycling, hormones is an eight letter, 4 letter word. You know what I mean? Oh, hormones. She's just being hormonal. But then as we like exit out of the scene, we're still afraid of those frigid hormones, which actually was providing, like you were saying, so much protection for us. So it's like hormones just can't catch a break. You know what I mean? They just can't, no matter what age you are. And so, yes, I love your advice of if the doctor ladies that you are working with is not maybe aware of the benefit, do some interviewing, get a second opinion, see if there are provider or professionals, medical professionals who can get you the right information. What would you say, Teresa, about here's another question we have from a listener. Do over-the-counter supplements really work? So like Vitex, DIM, you mentioned DHEA, but those were some of the examples she gave. What are some that you kind of offer as an option for women
Yeah.
over?
So first and foremost, supplements will never, ever, ever take the place of hormone replacement therapy. Like they won't even come close.
Hmm.
That's not to say that supplements can't be helpful, but they'll never come close to being able to provide the benefit that hormones do.
Hmm.
But the one that I probably use most frequently for like hot flashes and night sweats before a woman reaches full menopause is evening primrose oil. That seems to work good for my patients. So evening primrose oil is like a linoleic acid, and it provides some sort of an estrogen balancing. And so if I have my patients take one capsule 3 times a day, or sometimes just two at night, they really do get less hot flashes and night sweats, most
Hmm.
of them.
Yeah.
I use a lot of magnesium. I do a lot of nutrient support with just good vitamin care, just to make sure like their nutrients, their B vitamins, their iron levels, everything is being met. But I don't use a lot of like Vitex in perimenopause to menopause. I sometimes use maca root, but I don't find those things to be super helpful. In perimenopause, the most often thing I use is progesterone,
Hmm.
because before we got on, Jamie and I were talking about how
Yeah.
in perimenopause with estrogen, your estrogen is wildly fluctuating sometimes. I can check an estrogen in perimenopause and it can be 20, which is like very low and close to menopause, or it could be 500. So estrogen tends to wildly fluctuate, but progesterone, it always is calming down the whole space of what's going on. I call it the great stabilizer. And so I use a lot of progesterone in perimenopause to cooperate with the body, to cooperate with the cycles, to help with sleep, help with calming mood, those PMS symptoms. Sometimes it'll help with motivation and drive because the woman's cortisol is being balanced better. So,
Yeah.
and then it also helps with heavy periods and any disruption of the cycle that happens, which is not uncommon for some cycles to get out of balance, right? You can have, I think one of our questions was about premenstrual spotting and spotting for even longer than, 5 to 7 days. That really should be evaluated by a doctor, number one. So if you're having lots of unusual bleeding or spotting that goes on longer than, your periods lasting longer than 10 days, really that needs to be addressed by a physician first and foremost. But it may be an imbalance of those hormones, and progesterone, especially oral or vaginal progesterone, probably is going to help it if it's going to be a hormonal imbalance.
Mhm.
I heard someone say this the other day: is perimenopause is a diagnosis of exclusion. So that means that you have to make sure there's nothing else going on that are causing your symptoms first. Is it a thyroid problem? Do you have diabetes? Make sure you're not ignoring that it does take blood work and a good physician that you're working with to really figure out, okay, this is probably perimenopause.
Yeah.
And then you move on to correcting those hormonal imbalances.
Right. And that's actually a perfect point because one of the questions is about hair growth and quality. And so I have so much breakage, I cannot figure out why. I have tried all the things and nothing is helping. My stylist is even perplexed. So this is a question from one of our listeners. So again, estrogen has a drying or lack of estrogen has a drying effect. But also, if there's a thyroid issue, those same symptoms can maybe present itself in terms of hair. Do you have anything else you want to share about that?
Yeah, I mean, hair is going to thin as we get older. So there is some natural just process of hair thinning, but it doesn't mean you have to settle for your hair falling out or getting terrible.
Right.
Number one, you look at the thyroid, you do a very complete panel, and you make sure you have somebody who isn't going to just look at it and be like, it's fine,
Hmm.
even though it may not be fine. So you need someone who really understands the thyroid well. You have to have all the nutrients supported, particularly the B vitamins, iron, zinc, selenium. All those things have to be supported. Collagen can be helpful for some people's hair. And then hormones. Yeah. I mean, if you are in that state where you're now skipping periods or not having periods, this is where estrogen really can make a difference, because estrogen provides, like you said, I call it the softness of the feminine body, the lubrication. That's why it helps with joint pains, is because estrogen provides almost the lubrication in the joints. It's anti-inflammatory. It makes the heart vessels stay soft. The way that it helps with heart disease protection is by keeping the vessels less likely to harden, and it also keeps the platelets moving and things not sticking through the artery walls. It prevents endothelial damage. It keeps the blood pressure better regulated. So estrogen has all these beautiful things that it does in the body, but for hair, again, it keeps it more strong. And so it might be something where you need to talk to your doctor about balancing the hormones. And it doesn't hurt to always discuss with your dermatologist as well, because there are certain hair loss conditions that are beyond the scope of hormones, and a dermatologist has a specialty in hair loss as well.
Yeah, that's good. And then also just a little caveat, ladies, for those of you who are not charting your cycle, it is very important if we're going to time hormone use, that we know when we're using it. So for instance, Teresa talked about progesterone. We want to know that we're using progesterone at the right time in our cycle. Just like as a little thought there. And then when, of course, we reach menopause, it's different. But as you're cycling,
Yeah, it gets tricky, Jamie, because a lot of women don't know how to chart peak anymore, because peak becomes sometimes invisible. It doesn't show up in the mucus. It doesn't show up easily, sometimes even with the LH monitor. So it does get a little tricky. And sometimes we have to just make a decision. As I say, we
yeah.
have to make a decision to either do or not do. So a lot of times with progesterone, I might say, we're just going to take it for 2 weeks and stop and see if your period comes. If your
Sure.
period comes, we're going to time it to the next period.
Mhm.
And then if you get a cycle back, then we're going to cooperate and try to use it cooperatively, like you said, with ovulation and the peak day. But sometimes we're not doing that. As it gets
Mhm.
closer and closer to menopause, we're really
Right.
just making decisions based on each cycle until the point where, again, someone is like not cycling, they're not responding to progesterone anymore. That means they're not getting a period. And that usually means that the estrogen has now gotten so low that they're really at that point where we can make a decision to now add estrogen. And, that's where I think a lot of people are going to also want to know, what are my options, when it comes to hormone replacement therapy as well.
Well, that was a question that just came to mind, and you just somewhat answered it. So, when you're approaching the menopause years, you're taking progesterone, but let's say, like, no, like, we're done, like, ovarian shut down. So, you would know that because you're taking this progesterone, but a bleed would not follow.
That's right.
Wow, because the estrogen isn't building up the lining because there's not enough estrogen.
That's right.
Therefore, you're taking the progesterone. Okay. Well, that answers my question because I was like, well, how would you know? Because if there's always this kind of reboot, but that makes sense because you need estrogen to
Yeah. And
replenish.
it takes a little kind of skill to get it to kind of balance out till the very end. You really have to
Yeah.
be working with someone that can help you to get it right.
Right. Yeah. Oh, that's very interesting. Let's kind of start wrapping up here. There is one other thing I want to make sure we talk about. Again, this question was, how do you determine the difference between true anxiety, depression versus mood changes related to hormones? How much do SSRIs work or offer improvement during this transition?
Well, it's a great question. I mean, you have to it's really a hard one because the symptoms could really be exactly the same, but it
Yeah.
could be being caused by the hormone therapy. What I generally would do is try to decide when it occurred. Is it situational? Is it something life changing? Is there a relationship issue? Is there a death? Is it situational? Did it seem to happen kind of with the loss of your cycles? You kind of have to pinpoint, where did it occur and why did it occur?
Mhm.
Or has this been underlying and going on for a while? And we're just now kind of starting to ask the question, is this, depression? So, and then it becomes like treatment options. Like, you could go the route of hormones and it might help your depression. And if it doesn't, then you'll know it probably wasn't the right treatment. Or you could go the route of an SSRI, which helps with serotonin levels, and it may get better. But a lot of people try to avoid medication. A lot of my patients are like, if I really, they don't want to have to take antidepressants if they don't have to. So we try a lot of different things first. And maybe hormone balancing is one of those things they want to try first before doing an SSRI. But
Yeah.
an SSRI can be a very helpful treatment for people. And I'm not never going to say that that's not the right option. And I prescribe SSRIs, and I've seen it work wonders for people who are struggling and really having difficult times. So you really need to ask yourself, what is my quality of life? And if it's really poor, you kind of have to make a decision to pull that lever, and you got to not doing something isn't going to work.
Right.
So you got to make a decision. And if it, at least try a direction first. And then if that doesn't work, look further.
Yeah. Sometimes life gets so overwhelming, and so all these issues are kind of buzzing around all over. But I can't remember where I heard this advice from, but I love it and I've never forgotten it. It's like, if you could take one difficulty out of the picture or like address it immediately, what would that one thing be? And if it's that one thing, how much does that one thing play into all the other things that cause stress? So, for instance, if there's something really heavy going on, that stress sometimes makes other things that wouldn't normally stress you out, right? So then everything becomes really stressful, it seems. So, for an example, let's say with this question with the stress for the gal who asked that question, maybe like you were saying, Teresa, the thing that's causing the most issue, if you had to pick one thing, is really like your relationship with your husband, let's just say. Well, then that would be like, well, what can we do to pour into the relationship with your husband? And sometimes when we address that most hard thing, it really does help manage the stress and these other things. So, finding a good therapist, for example, or maybe it is your hormones. You have brain fog and it's driving you crazy and it affects all these other aspects of your life. Well, then we really want to make sure you're getting to the doctor and you're getting labs drawn. Because I think sometimes it's analysis paralysis. Your advice, Teresa, is to make sure you do something, to start with, well, what do we do? Start with that very first thing. Like, what's the thing that's causing the most stress? Um, And what can you do, create a plan, for that. So that's some reflection questions for you ladies as we kind of close up, and we can wrap up, Teresa, with some reminders. But what part of your life is the most stressful? What part of your day is the most stressful? Kind of be thinking about that. Because again, when we can start addressing those stressors, hopefully it has that ripple effect in other aspects of our life. Another reflection question is, if you could envision a happy, healthy you, what does that look like? What does your day look like? How would you be spending your time? How do you envision yourself? Sometimes I think about me and my husband, we're standing by the grill and he has gray hair and he's flipping burgers and he's laughing, and we're, maybe just came back from a run or something. So kind of envision, what do you want that life to look like? And then also ask yourself, what are your triggers, and create a plan around those triggers. Because again, as we talked about in this episode, as our hormones are reducing some of these things that cause mishap in our life, it causes maybe us to be more sensitive to those triggers. So even being self-aware of that. So those are some ways that I want to recap, and start to conclude our episode, Teresa. What are some things that you would like to kind of wrap up with?
Well, I guess Jamie, one thing is I never talked about the one thing I wanted to talk about, which is the the estrogen and the breast cancer thing. you
Oh
know,
yeah.
Out of
Mhm.
all the things, I just want to address this because this is the big elephant in the room always. Whenever I bring up to a patient, hey, let's talk about hormone replacement therapy, usually in the back of their brain, some little red light is going off and they're like, breast cancer, breast cancer, breast
Yes,
cancer, you
right.
know?
Hmm.
So we've got to address that elephant in the room, which is that estrogen has been linked in the past based on this large study called the Women's Health Initiative that was released in 2002. And it was told to the public, based on those study results, that estrogen was linked to breast cancer. But here is the deal, and all I want you to do is to look up, and you can read this book, get it on Audible. It's the greatest Audible ever. I love it so much. I've listened to it like 3 times at least. It's called Estrogen Matters by
Hmm.
Dr. Avram Blooming. Estrogen Matters. And if there's one resource that I can give you to make a decision about hormone replacement therapy and the safety of estrogen and the benefits of estrogen, it would be that book, Estrogen Matters. The reality is that and the data, the information that was given to the public wasn't correct. Estrogen does not cause breast cancer. And all of the studies that have been done up until this point, including the Women's Health Initiative, actually shows that. And in fact, in the Women's Health Initiative, which is a very large randomized controlled trial study that was for heart disease, not for breast cancer, it wasn't, that was a secondary thing they looked at. The women that took estrogen only had less breast cancer. It was the added synthetic progestin to a synthetic estrogen, which increased the risk of breast cancer, but it wasn't even statistically significant. It wasn't statistically significant, but they ran with that headline anyway. And it also misinterpreted the data on heart disease as well. So, but to understand that, you need to read Estrogen Matters by Dr. Avram Blooming, and that will kind of clear the air for you, at least give you the informed consent that you need to make the decision. And estrogen now, we use the bioidentical estrogen and micronized progesterone. Anybody who has a brain out there as a doctor is using bioidentical hormones. They may not call them bioidentical because I don't like that term, but bioidentical just means that it's equivalent to the hormone that you make in your body. Exactly. The chemical makeup is the same. That's what bioidentical means. It doesn't mean it comes from a compounding pharmacy. It can, but it doesn't mean it has to. And that the estrogen that we use is estradiol, and it usually in its safest form is a transdermal form, like a cream or a patch. It goes on the skin. That's safest for the heart. And we use a bioidentical progesterone, most of the time called micronized progesterone. Those are your best options for hormone replacement therapy, and they're safe. They're covered by insurance for most patients, and they provide you, again, the benefits of protection to heart disease, to protecting your brain, to protecting your bones, and protecting your heart. So these are important decisions, like I said. And I think the overwhelming amount of women who actually hear the right and correct evidence will actually choose to do some sort of hormone therapy. And remember, the last thing, Jamie, is be careful of reading the package inserts on hormones. like vaginal estrogen, for example. Vaginal estrogen, the package for vaginal estrogen, the bioidentical kind that you could get from Walgreens or CVS or any pharmacy, literally has on it warnings that tell you that it could cause dementia, cancer, and heart disease, which is completely not true. But it's on every hormone because I lump all of these things, and because of the damage that the Women's Health Initiative has done to hormone therapy, these labels now say things that really are not true at all. Vaginal estrogen can be used by any woman.
Mm-hmm.
Even a woman who's had breast cancer can use vaginal estrogen usually safely with no problem at all. And no woman should suffer from vaginal dryness, atrophy, pain with intercourse. So if there's anything that I can say, across the board, any woman could take, it would be vaginal estrogen would be safe.
Mm-hmm.
But all of these hormones really are safe for the vast majority of women. And women really need to make a decision with their doctors, have an informed conversation, and be able to kind of decide what's the best path forward for menopause for them.
Right. Would you say here real quick, a burning question, would you say that there may be a risk of estrogen therapy if elimination pathways are not open? So if women are constipated and they're recirculating at the high estrogen, just like with estrogen dominance, the same thing is true, where if we're not eliminating estrogens, or would you say estrogen just generally is not associated with breast cancer? Or is it the type of estrogen? Well, you said it was synthetic estrogens, that may be, and then the pairing of the synthetic progestin. But like sometimes I think that the elimination pathways, when they're closed, we're not maybe sweating, we're not having daily bowel movements. Does that increase a risk?
No,
Oh,
it's
okay. So
still
it's just,
no.
it's
I
still,
mean, yeah, I mean, I'm not saying like it's not a good thing to continue to work on detoxification of
sure,
estrogen, but because
sure.
all of the studies that have been done would not have taken that into account.
Got it.
Right.
Okay.
And it
Right.
still didn't cause breast cancer. So
Sure,
like
sure,
they weren't
sure.
looking at people's habits of detoxification or looking at byproducts of estrogen. So we can say that estrogen is safe. Now, certainly people who have take estrogen into their body. Now remember, in menopause, we don't use high levels of estrogen.
Right.
We use low dose preparations. So we're
Hmm.
not giving women anywhere near the amounts of estrogen that they made in their cycles.
Right.
We're just keeping them off the basement floor. Like I said, it's like you're kind of keeping women at the level of where their estrogen is at when they're at the end of their period. It's around like 30
Mm,
to 60. It's kind of the sweet spot, 30 to 80 maybe.
right.
But when you ovulate and in your, cycles, you make estrogen in the hundreds up to 300.
Right.
So, we're not giving them high amounts of estrogen, and we use the bioidentical kind and we use it transdermally, then it doesn't have to go through the gut and the liver, Jamie. The whole process is different for estrogen.
Interesting.
And that's
Hmm.
why it's so much safer in a sense. And it's being
Yeah.
able to be used in the receptor sites in the body
Mm.
very easily without having to be broken down in the liver first.
Yeah. Interesting. That's a very interesting thought, which I never put any thought to. So that's very important. Thanks for clearing that up. All right, Teresa, per usual, again, my favorite phrase that I've been using lately, per usual. Thank you for another amazing episode. I always learn so much from you, and I say that all the time. And we pray that this has helped the women that specifically sent their questions in. Thanks for doing that. If you ever have a question about a health matter, please send us an email, thehormonegenius@gmail.com. Just know that our podcast is for entertainment and mostly educational purposes only. We are not your doctor. We are not your healthcare team. So be sure that if you do have a specific medical question that you do ask your doctors, because we are unable to kind of work in that category, but we love to educate. So we can always teach you things, just as a little tip there. So again, thank you, Teresa, for today's episode, and we will see all of you